Bismillahirrahmanirrahim. There are certain things that are latest in ENT, and these are the recent advancement in ENT, and we can use these techniques curing the patient. These are laser, cobblator, gamma knife, cryosurgery, gelatin and fibrin glue, gel foam, surgicel, middle ear prosthesis, fez and balloon sinuplasty, and cochlear implant. What is laser? Laser is light amplification by stimulated emission of. First medium was used was ruby, and there are different types of laser: argon laser, ND-YAG laser, and carbon dioxide laser. In ENT, usually we use carbon dioxide laser, and these two lasers are usually used in surface problem like it is usually absorbed by colored fluid. So these are helpful in hemangiomas. So where we can use laser: in nose, we can use in papilloma for turbinates, sometimes in polyps, choanal atresia, in oral cavity, leukoplakia, erythroplakia, hemangiomas, lymphangiomas, and early stages of tumors. In oropharynx, we can perform tonsillectomy, and we can remove early stage. Larynx, we can use recurrent papillomatosis, papilloma of larynx, and congenital webs. In cases of bilateral abductor paralysis, we can evaporate posterior part of cords. In subglottic stenosis, in cases of granulomas and granulations after trauma, we can use these. So argon laser usually used in surface areas like in skin condition, nevi, hemangiomas, lymphangiomas, and tattoo mark, removal of these tattoos, and it is also used. So there are certain precautions we should take while using lasers. We should educate our staff. We should protect eyes with the help of certain glasses, and we should protect other part exposed areas, and there should be mechanism for evacuation of smoke, and we should avoid using anesthetic gases like isoflurane, nitrous oxide, and we should also protect the endotracheal tube with foil, because there is risk of fire and there will be burning of. So there are certain advantages of using lasers. There will be bloodless field, and there will be early recovery due to rapid epithelialization. Usually it is after surgery, patient will feel less pain, and there will be less tumor dissemination because of destruction of blood vessels around the tumor. So there are also certain disadvantages. We can't get material for biopsy, and it is with nitrogen and nitrous oxide, and we decrease the temperature of this medium up to -70 to -170 degree centigrade. It will destroy the normal tissue that surrounds the diseased tissue. So medium used is nitrous oxide and liquid nitrogen. So what is the mechanism? It will dehydrate the tissue, denaturation of protein, intracellular icing, vascular stasis, and cryoimmunization due to denaturation of. So where we can use it in benign vascular tumors, turbinate hypertrophy, papilloma, warts, pre-malignant conditions, and certain early stages of. So advantages of cryosurgery: it is OPD based procedure. If patient is not fit for general anesthesia, if there is risk of bleeding due to some bleeding disorder, palliation of recurrent cancers to reduce the bulk of tumor, and there will be post treatment pain will be less, and scarring with disadvantages. No tissue will be available for biopsy. Assessment of tumor margins is not possible because it also destroys the surrounding healthy tissue. No control on the depth of freezing, and it also and loss of hair. Now FES, that is functional endoscopic sinus surgery, and S is endoscopic sinus surgery. If we are doing surgery only to divert the pathophysiological phenomena like in chronic sinusitis, we will call it FES. If we are using this for removal of disease, it is called endoscopic sinus surgery. So mechanism is that we increase the ventilation of sinuses in cases of chronic rhinosinusitis. So it will be helpful in to develop normal ciliary action. So drainage of the sinuses will be better. So indication of using endoscopic surgery, we can do all type of ENT surgeries, nasal surgeries, that are nasal polyp, enterocoinal polyp, ethmoidal polyp, allergic polyps, chronic sinusitis, tumors, fungal infections, mucormycosis, and repair of CSF leakage, hypophysectomy. So complications are very severe complication. There can be CSF rhinorrhea. There can be some orbital complication because orbit is just lateral to nose. There can be hemorrhage due to damage to the anterior posterior ethmoidal artery. And so balloon sinuplasty, we can use this procedure in the sinuses which have only single ostium. So in cases of maxillary sinusitis, we can use this balloon. We inflate the balloon at the site of maxillary ostium and it will dilate the ostium. So there will be better drainage. We can also use this balloon. There are certain types of balloon. We can also dilate the eustachian tube with this balloon, but it is so recent thing is cochlear implant. So device that converts the sound signals to electrical impulses that directly stimulate the eighth nerve fibers. So we use cochlear implant in profound sensorineural hearing loss when the nerve fibers remain intact. So if the nerve fibers are there, we can stimulate these nerve fibers with the help of electrodes. So indications is bilateral severe to profound hearing loss when there is no benefit from hearing aids. Usually hearing aids are helpful in moderate hearing loss. In severe to profound hearing loss, these are not very helpful and we can advise cochlear implant. If there is no medical indication and the age of the child should be above, and we should, in cases of congenital hearing loss, we should perform this surgery before 2 to 3 years before the development of speech centers. Because if after that if there is no signal to the speech center, there will be failure of development of speech center. So cochlear implant has two parts, external component and internal component. External component has microphone, speech processor and transmitter. Internal component, that is implanted beneath the skin, and the electrodes are introduced into the round window to stimulate nerve endings of 8th cranial nerve. So inner part has receiver and stimulator and electrodes. So you can see the external part, that is this outside this is outside, and this is the internal part. It is implanted beneath the skin, just below the post-auricular skin, and these are the electrodes. These are passed through round window after doing posterior tympanotomy, and through round window we enter these. We get these electrodes are entered in the round window, and they stimulate the nerve endings of cochlear nerve. So you can see in this, these are the electrodes, and we pass these electrodes through round window, and they are entered into the cochlea, and they stimulate the nerve endings of it. So middle ear prosthesis usually used in cases of conductive hearing loss when there is damage of these ossicles due to chronic suppurative otitis media due to trauma. So there are partial ossicular reconstruction prosthesis and total ossicular reconstruction prosthesis. You can see this. We insert this prosthesis inside the middle ear, and it will hold the head of a suprastructure of stapes, and this is outer part that is underneath the malleus, and this is total. This is kept over the foot plate of stapes, and this is beneath the tympanic membrane. You can see how we use these prostheses. This is tympanic membrane, and this is the prosthesis, and this is the foot plate of stapes. There are certain glues such as fibrin glue that adhere the tissue. We can use these glues and material to adhere the ossicles, to adhere the skin, and it is also used in when we are performing CSF leakage procedures in cases of endoscopic sinus surgeries. And there are gel foam that are used when there is bleeding. We pack the point with the help of gel foam, and Surgisil. We also use Surgisil in cases of CSF rhinorrhea, and also it also increases the formation of collagen fibers. So these are the. What is gamma knife? Gamma knife is the type of stereotactic radiation that is used in brain tumors such as vestibular schwannoma. So it gives precise amount of radiation to a specific point. So advantage is that there will be less trauma to the surrounding tissue.